try to provide an overview of the comorbidity between borderline personality disorder and substance use disorder. Although I've done a fair amount of work in the area of treatment, I'm not going to be covering that today. Pretty much the rest of the day is really going to be providing some excellent coverage of that. So I'm going to stay much more focused on kind of giving you an overview of these two commonly co-occurring disorders. And I want to organize the talk by what I'll call the 3 C's, those being co-occurrence, complexity, and challenges. First, to talk about the prevalence of these, particularly the prevalence of the co-occurrence of these disorders. Briefly talk about the models that people have developed for why they co-occur. Some of the complexities, both in terms of how widely different patients with this comorbidity can differ from one another, and as a consequence, some of the attempts to subtype those patients into groups that might have treatment relevance, and then spend a little bit of time on some of the challenges that are faced by patients, providers, and family members. So the first question that you could ask me is why am I ignoring my own advice that I give to other people to never start a talk with a list of diagnostic criteria? Sure, talk killer to start this way. Well, there's 2 reasons for that. One is that although certainly patients as well as providers who are working in the mental health treatment system are probably very familiar with these list of 9 criteria, there may be providers from the substance abuse treatment community or family members who this is their very first conference that they're kind of hearing people talk about this disorder that they're concerned about when their family members have them. So I think it's a safe way to begin the talk, but also because I think it's an initial illustration of these 3 C's that I want to cover today: co-occurrence, complexity, and challenges. The first C, for co-occurrence, is that if you look through these 9 criteria, you'll realize that although the constellation of these symptoms don't appear in every single substance abuse patient that we see, as you go down through one of these and you think about patients that you've had, or if you are a patient who has substance abuse problem, each one of these occurs fairly commonly in people with substance abuse problems. So that's sort of an initial hint that these are disorders that have got some overlap. The second C of complexity is captured by the differences in font that are up here. I've just picked out and have bolded in italics, which I think is 2, 4, 5, 6, and 8. Those 5 criteria that when people think about someone having a borderline personality disorder, those tend to sort of jump out at them as being the most dramatic sort of symptoms and troubling symptoms to kind of experience if you're a patient or treat if you're the provider. But to keep in mind that there are all different kinds of ways that one can meet criteria for borderline personality disorder, and thus the weak attempt at a joke of referring to this as a 151 proof disorder. What I mean by that is that because you've got 9 criteria and you only need 5 of them to meet the criteria, there are 151 ways in which you can have borderline personality disorder. Okay, so no 2 individual patients are going to be exactly alike. The bad joke in there really is that this is a high-octane psychiatric disorder. This would not be something any more than a naive drinker would not want to have their first drink be 151 proof. This is not a patient population of people with BPD and substance use disorders that you want to launch into without sufficient training and without sufficient supervisory support. And then the last piece of it, with regard to the third C, which is the challenges, is that any one of these symptoms is a challenge to treat. And when you bring these all together as a cluster or constellation, you're often faced with dealing with a patient, particularly one when they have co-occurring substance use disorder, that is quite challenging.